Okay, so we want to thank everyone who is listening. We are Raw and Uncut. It's myself, Tamara and Viloshni. I am located in the US. Viloshni is in South Africa. And we bring you every week topics on love, sex, and relationships. And we're also going to throw sex toys in there. This broadcast today is being sponsored by Lavology University. They're located in Los Angeles, California, which is where Viloshni and myself have gotten our certifications. I am a certified lavologist and love coach, a master sexpert, a sex toy expert, and I've been in the adult products industry for over 25 years. And Viloshni is one of our master sexperts, and she is bringing, well, she's not really into the adult novelty sector yet, but she's bringing all of her knowledge and experience into this broadcast. So Viloshni.
Thank you, Tamara. We have great pleasure tonight to introduce you to an amazing power couple in the sex industry. Firstly, Dominic. Dominic is shy, but not when it comes to issues of sex and sexual wellness. He started this business on a whim back in 2016 after noticing the gap and negative stigma that existed in the world when it comes to something as basic as a need of sex. Quite the juxtaposition exists. Being a man who is occupying space in a predominantly female-run sector, Mr. HunnyBunn, as he is fondly known, and the name of his company, is quite an enigma and a real force to be reckoned with. And he is accompanied by his stunningly beautiful wife, Dr. Kunene, a vibrant young doctor who has been working exclusively in the field of obstetrics and gynecology for the greater part of 4 years. No specialist, but she definitely has a keen interest in women's sexual and reproductive health. As such, she is currently studying towards a diploma in the field. With HunnyBunn, she shares a mutual passion to impart insights and knowledge on sexual education, well-being, and liberation as a whole. After all, an empowered being has the power to take over the world. So over to you, Tamara.
So here goes the questions, guys. So Dominic, how'd you get involved in the adult pleasure products industry, and how's it going for you as far as that is concerned?
So I got into this because of the conversations I'd hear around, like with my peers, the things they talk about, and I felt very out. You know, I'd say things like I'd go down on my partner for 45 minutes and I'd time it. If she stops me, then I'll start over the clock. You know, those types of things, and they were so weird. You know, they seemed so weird to them, and the fact that would speak about contraceptives and none of my male friends knew even one name, you know. So that was like my pushing force. Like, no, we need to educate ourselves. We need to educate each other. And it is so, so, so important. Because as men, I found that we enjoy sex, we talk about sex, but it's only about us. I was like, nah, gents, doesn't work that way. You know, let's incorporate our knowledge and all our experiences, our fetishes and everything with our partner or partners, you know. So I think that was the birth of it.
Yeah, but not only incorporate the knowledge, I think to also just, you know, make people aware of it, because it's something that wasn't,
Okay.
It's something that wasn't really spoken about. Sorry. Just
no, it's okay.
the sound on the side. Yeah, so as I was saying, it wasn't just incorporating that knowledge, but also just getting the knowledge out there, because amongst our peers, I think a lot of conversations happen based on our personal experiences and what we seem to think is correct, because I don't know how far reaching it is in the States, but here in South Africa, especially within the minority groups, conversations about sex and sexuality and sexual well-being and just our bodies don't really happen with our parents. So a lot of the things that we know and, you know, how we navigate is basically just based on what we hear in the streets, so to speak.
Right.
So, yeah.
Yeah, so, you know, it's the same here in the States. We are not taught, it's not talked about with our family, like our parents never tell us anything. And actually sex toy sales here are mainly white women. They're our majority here. And it's really hard. Like, I started in this business to break a barrier, to make it easy for people of color here, mostly Black people, to understand that sex is okay, and that it's okay to talk about it, even if it's amongst just their friends, or even like for me, trying to break that barrier with my mom, who's my mother's 78, and sometimes she doesn't want to hear it, but I've been in it for so long, you know, I just kind of slip it in there, but also just taking it to that generation after me, to be able to just let them know that it's okay. And so, yeah, so we're dealing with sort of the same type of experience here.
Okay, so Dominic, can you just maybe share with us, were there any reactions, negative reactions that you had to deal with when you started your business?
Yeah, no, definitely a lot. But luckily, I have a very supportive mother. So when I mentioned this the first time, I was like, hey, yo, mom, I want to sell sex toys, dildos, vibrators, and anal plugs. She was like, oh, okay. And it just happened just like that, you know, because she was a flight attendant. So she'd go to different parts of the world. I'm like, nah, go to this place, bring this back home for me. And then it was that way. And then amongst my friends and people I interact with, it was very weird. I can imagine, you know, till this day, some people call me the dildo guy. But now in the beginning, you know, I was a bit, you know, trying to make fun. Yeah, hey, dildo guy, you sell dildos, you know. But now it's a cool thing. Like, oh shit, this person sells dildos, and you know, and I think people have kind of shifted the way they think. But I still get a lot of negative comments from men that think, no, this thing's gonna replace me. No, there's no need for this. Hey, I'm here, you know. But that just kind of shows that toxic masculinity that we have, you know. But I'm here to change that. It's okay, hey, yo, bro, it's okay to masturbate. And they pretend as if they don't masturbate. That pisses me off so much. So I want to put it in their faces. Hey, masturbate, my man. Yeah. Yeah, look, in the beginning, it was very tough, very negative. But now, you know, people call me at odd hours. Hey, this is happening. How do I deal with this problem? What pills should I try to take maybe to increase my libido or whatever, you know? So now it's very different.
That's good. I mean, for me, I'm impressed because you're young and that you have the ability to reach out. And being a man, sometimes it's really hard, but I think you're doing an amazing job. So, you know, I've been on your social media and I see what you're doing, and you know, just keep doing what you're doing. And eventually people who still aren't on the, who are on the fence with you, they'll come out, you know, come out and be okay with it. So my question is, has there any, oh no, you didn't answer. Sorry. I'm trying to get these questions right. Has there been any major challenges that you've faced with selling or, you know, being in this industry?
I think the biggest challenge is the stigma attached to sex toys and anything sexual. You know, the LGBTI community is frowned upon and all those things. And now trying to get through to a person who's hard-headed that refuses to, you know, I think that's one of the biggest, I think that's one of the biggest challenges. But I've found ways to almost navigate around that, to say, look, it's okay, you know, and I always make it very clear that I don't only sell sex toys, but I sell sexual health and wellness, you know. So if I come to you and I say, hey, I've got something, don't think a dildo, think massage oil, think lingerie, think candles, you know, those types of things. So yeah, those are the challenges. The biggest challenge I'd say is, you know, just getting through to people, educating, and in educating myself, you know, speaking to different people so I can learn and pass the message on.
Yeah, one of our biggest issues here is sort of the same. And so what has happened is, instead of saying sex toys, we've changed it to pleasure products. And that's not only to our retailers, but it's our manufacturers as well. So, you know, instead of, because I never tell people that I sell sex toys, I'll either say that I'm in the adult entertainment, that I'm in adult entertainment, and that I represent the pleasure product side. So, because a lot of people want to place us in porn, and they do that all the time. And so we, you know, it's hard for us to get bank accounts under our business names or anything like that, because we have to not say that we're adult in order to function here.
Can I just ask, has that changed? Have you seen a shift then in the dynamic, having gone from calling it sex toys to pleasure toys? So like statistically, has there been much of a change, or are you still working towards that as an industry?
So as far as saying the pleasure products, the change has sort of just been in our industry, but not with our consumers. So they still are trying, they still have to catch up to that. They're not there yet, but eventually, so in the whole 25 years that I've been in business, I have reached a lot of people of color. I run an association, and I want to say probably 90% of my membership, they're Black. And we have a lot of people, so we teach them how to break that bridge, so that people who are, you know, of color, not just Black people, but anybody who's not white, how to be able to talk to them and, you know, get past the cultural thing. It's a big cultural thing, but here in the US, everything is either Black or white. And so we just keep pushing forward and try to come up with innovative ways to make it sound not so sexual, because culturally, that's not a topic that we discuss in the house.
Oh, okay.
I think we face a lot of the same issues, you know, especially when you said in the US, a lot of things are Black and white. I think that's a problem that we face here in South Africa too. Right. And one thing that HunnyBunn has been able to do is to reach the minority groups, and predominantly, you know, the Black people, and actually create and form open conversations about sex that we otherwise wouldn't be having in our households. You know, people are engaging on the topic more. So it is quite encouraging, you know, to be in a place where you can actually see growth, and you can see a change in not only people, but the way that they think, and just the way that they conduct themselves, you know, the way conversations are now structured. There's been a shift from the stigma to being more self-loving and more accepting. So yeah, that's definitely a thing that we have as well.
Yeah, I talk about you guys a lot here, and I am really trying to get some of our people here to be able to help you to continue your quest. And so I'm working on some program, or not programs, but some sponsoring to kind of help you guys keep moving forward, because you are actually the first person that I've met in South Africa that does this. And also we have manufacturers who come there and they look at it, and this was like 10 years ago though, but they look at it as that it hasn't pushed forward, and I'm letting them know that it has. So, oh, that's cute. Helping you out. That's love right there. Viloshni.
So do you want to share with us perhaps some of your favorites that you recommend to your customers?
I feel like those questions should be directed to her, and I want you to ask her how many toys she has personally. But on my side, if I talk, on my side, and always, it'll depend who I'm talking to. Look, if you're a beginner, to be safe, and I ask, when you masturbate, I've got a set questions I ask. Okay, do you prefer clit stimulation, penetration, both clit stimulation and penetration? Are you a beginner? And if into penetration, do you not have the little mini bullets? The wand is always a classic, Yeah, so for me, that's where I play. And then with the gents, with the guys, I'd ask the same questions. Do you want something you can go crazy with? Do you want a pocket pussy that has a suction base? Like, okay, you can do this in the shower and vibrate. Do you want the remote control? And for couples, I think one of the best, the easiest to introduce into a relationship would have to be into a partnership or whatever, would have to be the penis ring. That's safe, that's standard, you can play around with that. You can use the vibrating bullet without your partner when you're together, So yeah, for me, it depends. It depends.
Okay.
Then over to the lady here and her.
You're putting me on the spotlight. I mean, like, Viloshni already knows the answer to this question, but I don't know, I'm sitting on like a solid maybe 20 building in my collection. I think the important thing, that Dominic also highlighted is the fact that sex is fluid, and there's not one thing that will satisfy a person. I myself, depending on my mood, where my head is at, how I'm feeling that day, require something different from sex. And I think that's why I have such a variety of toys, because you can't get any one toy that will cater to all your sexual needs. My personal favorite is clitoral stimulation. So there's a wand. It looks like, the classic, like, first ones that ever came out in like very, very old pornographic films, and it's red. So, it screams passion and just fieriness, and it's my absolute favorite thing in the world. It packs a lot of punch. Like, you're my first favorite thing in the world. It packs a lot of punch. And if you're looking for clitoral stimulation, I mean, it is quite big. So it's not something that's discreet that you can carry on, but there are ones that are much smaller and are actually like ergonomically designed so that you can hold them the right way, you can bend it right, because I mean, our anatomy isn't the same and everything differs for everyone. So having conversations where you actually engage with people prior to you actually recommending that this and this is a bestseller are very important, because you can then elicit what that person requires and what it is that they're looking for. Kegel balls are also, like, I would say probably a second. Sure, it's the power, man. Like, the results are, you can feel them. That's the one thing, you go into something and then you come out of it better and stronger. So Kegel balls are a definite favorite. They also have tons of health benefits, just apart from sexual benefits too. So they make your perineal muscles stronger. They can help if you suffer with incontinence. They can help strengthen your pelvic floor muscles. So after childbirth, your pelvic floor muscles can weaken as you age. And these are all things that contribute towards like embarrassing things like incontinence. Nobody wants to laugh and have a dribble of pee come out type of thing. So I mean, on top of having amazing orgasms, you have a load of health benefits as well. So that's a great one. And then Penetration wise, for me, I think dildos are flat. So I prefer like vibrating penetrative toys. What would be the favorite?
What favorite is the red one?
Okay, no, my favorite is the red one. But yeah, no, it's pretty much those. So it just depends on what it is that you're looking for, really.
Yeah.
I thought you were going to say your penetrative toy was Dominic.
I mean, look, I don't refer to him as a toy. He's like my everything.
Yeah, so cute and sweet, hey?
I wanted to just quickly, have you ever seen this?
Oh yeah,
Yes.
vibrating egg bullets.
No, this is a Kegel Exerciser.
Oh yeah, oh yeah.
And so when you insert it in,
Oh yes.
you squeeze it with your muscles and it'll turn it on. And as you get stronger, the vibration will get stronger. So when you squeeze it and it's really low vibration, and you can't really feel it, but when you squeeze harder and harder, the vibration gets stronger and stronger. It lets you know how you're doing with as far as your Kegel strength or your muscle strength. And so this is mine. But this is, I'm postmenopausal, and I also, I had a hysterectomy. And so this is just to help me tighten my muscles and so that my vaginal walls won't fall out all over the place. So yeah. So I'll get you information on this and to see how we can get that to you, because I think it would be great for clients who are having yeah.
And that's, it's such a great toy because it also gives you like a mental, you can like mentally visualize the progress that you've made. So you don't feel like you're not really getting anywhere with it. Because I mean, personally at work, we've struggled with it. So Kegel exercises are a form of like conservative management in some conditions. And when you approach someone with the, you have to do Kegels at home and time them, and this is what you do. And, people kind of give you this look like, aren't you going to give me anything that's more tangible? And I think for them, it's this concept of leaving the hospital and then just having to, do exercises, they don't quite understand, but they also can't gauge just how far they've gotten. And it isn't always easy to see progress, even if you have made some. So I think that toy is amazing, right?
Yeah. My doctor told me to do Kegels because we do it naturally on our own, but 25 rapid. And so I always say to people, because I had to do 100 at a time, and what happens when you rapidly contract? You have an orgasm. So I didn't want to walk around having an orgasm trying to do my exercises. So I just bought something. I'm all walking around just, happy. So yeah. And so I thought this would be something great that women don't have to that's pressure when you have to deal with that. And so to give you less pressure, the Benoit balls are great. I do have a question on your Benoit balls. Have you ever had sex with them in?
Personally, no.
Try it. They're not going anywhere.
Okay, thanks.
That's your little tip for today.
No tips, times two.
So I don't know how to actually pronounce your name. Can you say it for me?
Me?
Yes.
Londiwe. Londiwe.
Okay. Londiwe. Would you like to share with us some of the issues women face that impact their ability to enjoy sex? And from a clinical point of view, how does it get addressed?
So I'll just talk on personal experience, common problems that women have presented to me with personally and things that I've had to deal with in the hospital. I think one of the biggest things is dyspareunia. So that's a condition where you essentially experience painful intercourse, and that could be either slightly before sex. I mean, as a mental thing, you know, when you're preparing, you already feel that anxiety already, you know, makes you feel anxious, and it can cause a bit of pain in your genital regions. Could be during sex and a little bit after sex, you know, as an after effect. And one of the biggest contributing factors to dyspareunia is vaginal dryness. And this is something that we see with a lot of women who have now, number one, are perimenopausal or are now postmenopausal, because we know that the vaginal walls are lined with like a lubricant, a very thin lubricant layer. And that's the alkaline layer that allows sperm to thrive in the vaginal space and in the vaginal environment. And as you age, your hormones become imbalanced. So your estrogen levels aren't as great as they were, you know, in your prime. So that in its own can cause you to experience vaginal dryness, and that will lead to obviously painful sex. It can lead to trauma in the genital region, where that pain not only now lasts during the act of sex, but also after. And it has psychological effects as well, because it's how can I say it? Like it's a basis of embarrassment, so to speak, where people feel like it's something that they can't talk to their partners about, number one. But even with us in a clinical setting, it's usually the complaint that comes in just before the patient walks out of the door, you know, like as a, by the by, I just wanted to ask, I've been experiencing this problem. And I think with me being so young and treating patients who I would look at as a grandmother and patients who would look at me as, you know, a granddaughter, sometimes the conversations are so difficult to have, and you can tell just how embarrassing embarrassing it is for them to even bring it up. So it forms, like, psychologically, it's a huge thing as well. It affects people who are on chemotherapy, radiotherapy, so any form of like very strong cancer treatments as well. So it is something that they struggle with a lot. And any woman who's had a hysterectomy and they've taken the ovaries out as well. So a hysterectomy is when you remove a surgical removal of the uterus. So you can either remove just the uterus, or you can remove the uterus together with the ovaries and the accessory structures, so the fallopian tubes and all of that. And because your ovaries are your estrogen centers, once they're out, you need to get some form of hormone replacement therapy. But even that has a timeline. You can only give hormone replacement therapy to a certain point, and then there's nothing we can do beyond that, you know, for women. So one of the first things is just teaching people about lubricants, like using exogenous, so like outside forms of lubrication. So there are different forms of lubricants, water-based, silicone-based, oil-based lubricants. First and foremost, I think that's the one thing, and just encouraging people to talk about it, because remember, in the clinical setting, it's not just about treating the actual condition, but it's about treating a patient holistically. And we're not necessarily trained in psychology and how to have those conversations, but it is important to start those conversations off, and then also engage in like multidisciplinary team management, where I can refer someone to a psychologist so that they can have those important conversations with someone. So you don't just stop at, I've seen you, I've given you a lubricant, now go home. Another thing is, if it is a medical condition that's causing the dryness and the issues, then we obviously need to investigate it further, and you treat the cause. Because if you just treat the symptom and not the cause, the problem will keep coming back, and it can have knock-off effects, where women start presenting with a lot of urinary tract infections. And even if you treat the UTI the first time, it comes back and it comes back and it comes back. So even in those settings, and if you are a person who personally struggles with like recurrent UTIs and vaginal dryness, go and seek medical care. But you can go into a drugstore and get yourself a lubricant, and that's nothing to be embarrassed about, because even in your prime, you know, you go through cycles where you do become dry, and there are times when, you know, you really do become wet. So I think just normalizing the situation is also like a great management point, and something that we really stress, because you then leave a patient empowered. And I think myself and Dominic are very big on empowerment. Wherever it is that we go, whatever it is that we do, we want to make sure that we leave a person empowered, because you know that a person can make their own decisions, they make informed decisions, and they actually know that they're going about something, but with an understanding of what that thing actually is.
Right.
Yeah, so I think that's the main thing, and that's the one that really seems to stress women a lot, and it's something that a lot of people can't talk about. A lot of people have stigma attached to it, and we really shouldn't. So I think just normalizing the situation and really trying to get to the nitty-gritties of the problem.
Yeah, I understand. I'm 59 and I had a hysterectomy at 35.
You really don't look it.
Oh, thank you.
I'd say 49.
But I had a hysterectomy at 35, so I get that, and it is really important, and that's great that you guys are educating and having conversation with my group, you know, the women that we're in the just before our final stages of life, and so that's great. All right, we are coming close to the ending, but Viloshni has another question.
I think it would be my last question. So this question is either Dominic or Londiwe, whoever's comfortable answering it. Basically, since the lockdown and since the pandemic has hit us, tell us what has happened with the sales of sex toys, and maybe just give us your view as to why you think that's happened.
Oh, okay. Oh, no.
So
on my end, the first week when they put us on lockdown on level 5, that was last year in June.
It was like March,
April. Mm-hmm. People were, for the first time, at home with their wives, with their girlfriends, and they were like, actually, I'm kidding, but there was a spike. It wasn't a gradual mindset, it was a pew, definitely, that's what you realize. And the single men that can't go out anymore and say, hey, yo, what do you do? We're at home, you can't leave the house, so what can you get? Then you get yourself a little pocket pussy, So look, I won't lie, the pandemic helped a bit in the sales, like they went really, really, really high. And from then till now, I think because so many people were engaging, people were at home, couldn't go to work, you're on your phone, you see these things, you're like, okay, then you start to, and there's been a constant mountain going on. So yeah, on my side, I don't know.
Yeah, it's about the same here too.
Yeah.
For me, it's not more on the sales side, because that's more your thing. But just like general conversations that people have been having have changed as well. Yeah. Like suddenly, so with me, as much as I am sexually liberated, I think one of the difficulties for me was putting that across to people that I was close with, where I could sit down and have a conversation and say, this is what my partner does, and this is what we do together, and this is what we're working towards doing. It was always such a difficult conversation to start, but I noticed that when lockdown happened, I didn't need to start the conversations anymore. Like the conversations came, in a room, and we talk about a burger, talk about, I don't know, a pet, and then suddenly we were all talking about sex, and the conversations just started happening more and more, and people started engaging more and more. So I think for me, that's the one difference that I've noted, where people are becoming more open. And I guess it is that you have nowhere to go, you have nothing to do. You run out of stuff to do, and you're like, well, I mean,
I've got time for myself.
Yes, and you start focusing on yourself, and you start asking other people what they do, to ease their own tensions and those things. Right. So it really opened up conversations.
That's awesome, because it also seems like you identified as a person that people have comfort speaking with and speaking openly as well.
Yeah, definitely.
Awesome. Any Tamara, any questions from your side that you want to ask the lovely couple before we say goodbye?
Well, no, because I have learned a lot. I think you guys should experiment with your Benoit balls. And
Oh, yes.
then the next time we come on, I want to hear every detail. I want to know
Every
detail. But it was great. It was great talking with you guys. We have to do this again for sure.
Please.
I would love that.
Absolutely. So thank you very much, Dominic and Londiwe, for giving us your time. This was Raw, Real, and Uncut with Tamara and Viloshni, brought to you by Loveology University for Higher Learning and Loving. Our mission is to empower adults through positive, accurate education on love, romance, relationships, intimacy, and human sexuality across the globe. If you want to become a love or relationship coach, go to loveuniv.com and help make the world a more loving place. Thank you all. Good night.